Okay, so we're starting chapter 1 of our EHR. I know you guys are all excited that we are done with the step-by-step. Finally. Okay, so we're actually going to be talking about today, what is a medical record? So a medical record is a physical collection of an individual's healthcare information. It's been used throughout history to document patient healthcare, signs and symptoms, diseases, and trends of disease. And I want to take a pause right there because I want to ask you to look in your book on page 2. And that little section right there says the history of medical records. And I just have something highlighted that I'm going to read real quick. Medical records and death ledgers were kept during the plagues that swept through Europe during the 14th and 17th centuries. In the United States during the Civil War era, soldiers' medical records documented nervous disease, later was known as shell shock, and now post-traumatic stress disorder, as well as injuries suffered in combat and infectious disease contracted in the crowded, unsanitary military camps. So even back in the days when paper was scarce, they actually still did medical records. And then I'm just going to read that first line underneath the history of medical records. Nearly as long as there have been physicians, there have been medical records. A patient medical record is a complete physical collection of an individual's healthcare information. If you haven't highlighted that, please do so. A patient medical record is a complete physical collection of an individual's healthcare information. That's important. The content of the electronic health record. EHR stands for electronic health record. So many times you're going to be seeing EHR and not electronic health record. Hey, Jordan, baby, I'm actually going to post this whole thing on our Emoto. You can still take pictures, but I'm actually recording it so we can do it that way, okay? But you're good. You can take pictures. Okay, each patient has his or her own record. Documentation is a vital component of the EHR, and it contains health information, administrative information, and legal documents. We'll get caught up on these here. Okay, clinical information that can be found in the EHR is a medication list, allergy lists, immunization records, laboratory records, pathology reports, vital signs, growth charts, surgical reports, hospital records, history and physical assessment findings, progress notes, radiology reports, and imaging test results. Do any of you guys recognize any of those things? Say again, Josette, I can't. Do you recognize any of those things? Some of them?
All.
All? How about you other guys? Just kind of chime in.
Yes.
Yes.
Jordan, you recognize some of those things? Okay, all right. All right, administrative information. This consists of patient demographics. That's where we go in and put their name, their address, their phone number, their social security number, their insurance information. Those are called demographics. The name of emergency contact person, patient correspondence, referral and consultation letters, insurance information, HIPAA claim status, billing account ledgers, super bills, encounter forms, day sheets, appointment history, diagnostic and procedure codes. So I want to stop right here and just kind of give you guys a heads up. Does anybody know what HIPAA stands for? It is Health Insurance Portability and Accountability Act. You really need to know that. HIPAA is what protects private information. You know, we talk about the HIPAA laws. Legal documents. On occasion, a patient medical record may be used during court proceedings for malpractice suits. We don't want any of those. through accurate documentation helps prove what, when, and why something happened. So some legal documents that are actually in EHR is a records release, informed consent documents, HIPAA forms, advance directives, living wills, insurance authorization forms, healthcare power of attorney forms. You guys really need to know the difference between advance directives, living wills, and power of attorneys. There's not a vast difference. They're just little tweaks. So you need to really kind of pay close attention to those things. Okay, who can document in the medical record? Let's see, individuals who are responsible for inputting information into the medical record are a documenter, a receptionist, medical assistant, a physician or other treating professional, and a medical biller. I'm sorry, I'm turning my pages, guys. I think I got to read it there and here. Okay, okay, this is so important. Who owns the medical record? Do any of you know who owns the medical record?
The doctor who created it.
And the people who keep it up.
I'm trying to think of a way to put it. So the patient owns their address, they own their name, they own their social security number, but we own the record, the paper record.
So like the patient owns the demographics, but not the information.
Well, the verbal
necessity.
information actually belongs to the patient. The verbal information belongs to the patient. But what's documented in the EHR, it belongs to the person, the people who maintain it. So it's the property, who owns the medical record? Property of the individual who created it. So who creates demographics? We do, right? The physician office owns the physical record. A patient owns the medical information they're giving you. They may obtain a copy by signing a records release, and they may be charged an administrative fee. I'm going to ask a question. I want you guys to think about it a second and then give me an answer. Here's the scenario. We fired a patient from the clinic because they refused to follow doctor's orders. They come in and they demand their medical records. You tell them, okay, well, I need you to sign a release form. They refuse to sign that release form. What happens? Okay.
They don't get the record.
Joe, what did you say? I couldn't hear you.
Same thing Kelly said. They don't get the record.
What about you, Miss Sue? Sydney, can y'all hear me? Just chime in because I can't see y'all.
Yeah. Yeah, they can't get the record without signing it.
Miss
I have
Rebecca?
to lay my hand. Did you see that?
Yeah. Miss Rebecca, oh, maybe I can. Oh, there. I figured out how to see everybody now, guys. Sorry, I'm still learning. You have to push the little arrow down there. So there's my other lady. If they don't.
Did you see my raise my hand?
No, ma'am. I just saw. I just got to see you. So if they come in and the person refuses to sign a medical release form, they cannot have the record. You actually own the paper that it's on. So that's very, very important. It's a legal document. You have to sign a legal release. And if they make copies, sometimes the doctor's office charges for that, but not always. Okay, so we're going to move on. The EHR. Ideally, the EHR can exchange data freely with other computer systems, such as those of our healthcare providers, pharmacies, hospitals, laboratories, and insurance companies, creating one central EHR that is easily accessible to authorized parties, yet secure from those who do not have a right to see it. It has 8 core functions. These are its functions: health information and data management, results management, order management, decision support, electronic communication and connectivity, patient support, administrative process, reporting and population health. I want credit for saying connectivity right because I practice it. I got all tongue-tied when I read through it earlier. I was like, oh, y'all expect that from me though, but I was really proud of me. Okay, so the transition from paper to electronic health records. They started that in from 2004 to 2014. It's called the Decade of HIT. HIT stands for Health Information Technology. Okay, so on this slide, I'm going to read through it, but there's something that's really, really, really important that I want to talk about at the bottom. It's the Meaningful Use Incentive Program. You're going to be hearing meaningful use, meaningful use, meaningful use, and this is all that it is. As of 2007 to 2008, only 17% of practices had adopted an EHR system. Of course, now we're all the way to 2020, right? Most have adopted it, and then some are a hybrid, which they do some paper and some EHR. So we're going to move on down to Meaningful Use Incentive Program. It improves the quality, safety, and efficiency, engages patients and family, it improves care coordination, and it maintains privacy. Okay, so I want you to pay close attention to this because this is actually, I can't remember if it's your homework or your lab. I have my paper here somewhere. Let me see.
It's homework.
Thank you. I appreciate it. This is your homework. Doesn't have to be complicated, but you need to know the difference between EHR and EMR. There's just small differences, okay? It's not a huge thing. They're interconnected aggregate of all patients' health records. See, I knew I was going to mess up one word or another. Data from multiple providers, data from multiple healthcare facilities, electronic patient record created and maintained by a single provider, and a component of the EHR. Okay, here's some basic functions of the EHR, and I'm just going to go through this quickly so we can get finished. Fax and messaging, patient reminders, vital signs data, importation of data, automatic flagging, email, print, progress notes, documentation templates, provider review of incoming data, image attachment, electronic signature insertion, and prescription template. Okay, CDS is Clinical Decision Support. Allows providers to set protocol for specific patients and/or conditions based on evidence-based treatment protocols, automated preventive care reminders, treatment plan templates, generates patient data reports and documentation templates. Practice management software. It is called PMS, but it's not what we're used to calling PMS. So it's an administrative software used for patient demographics, billing and insurance information, appointment scheduling, advanced accounting procedures, and these tasks are now incorporated actually into the EHR. Okay, here's just some pictures of when you actually are able to get into your SIMS charting. You're going to be able to go into a simulation playground and you're going to be able to see these things. It's just pictures. Here's some advantages of the EHR. Improved quality and community of care, management of chronic diseases, disaster preparedness response. I wonder if we had any of that in place at this point. Increased efficiency, improved documentation, easier accessibility at the point of care, better security, reduced overall expense, job and patient satisfaction. Here's some disadvantages. Lack of interoperability among some products. That interoperability is a vocab word and you're going to need to know it for your quiz. Unusual cost, financial investment, and implementation time. What they're talking about there is that facilities actually have to pay for these EHRs. And they have reps and they come out and they show you samples and then you choose which one. Employee resistance, which means you have older employees. You know, I always say the 25-year encoder that doesn't want to change. You have those everywhere you go. Regimentation and security gaps. Okay, the role of a healthcare professional. Okay, here's some basic needed things. We need knowledge of medical terminology. Have we been learning that? Yes, we have. So that's where that comes in. Every part of healthcare is important. This is no exception. So people may say, well, you're a coder. What do you know? You're a biller. What do you know? You're a front desk. What do you know? But we're all a part of an important part of a team. The back of the house can't do what they need to do if the front of the house is not doing what they need to do. The doctor isn't going to get paid if we're not doing what we need to do. And if he's not doing what he needs to do, if he's not documenting. We need to know basic typing and computer skills. Yes, you have to get comfortable. It takes time, but you can get it. Guys, I am the living embodiment of this right now. There you go. YouTube channel is all I have to say, okay? Organizational skills, prepare yourself to go paperless. Interpersonal skills, help the patients through transitions too. Doesn't matter what job you have, you're always going to have to be able to talk to people and be able to be professional and kind and courteous and lead them through whatever process they need. Okay, here's some administrative duties. I'm not going to read through those. They're on there, right there. So I'll give you a second to read through those really quick. Okay, I'm gonna move on. Clinical duties are documenting treatment, coordinating patient care, documenting the following: patient history and physical, vital signs, progress note, laboratory requisitions, prescription, and test results. I have not ever had to do this or an administrative medical assistant, but sometimes our curriculum crosses with a regular medical assistant, you know, the one Miss Marcia teaches. And so most of these would be their clinical duties. We would be more the administrative part and not necessarily this. Here we go, billing and coding duties. Creating billing statements, assigning procedural and diagnostic codes, linking codes for reimbursement, auditing, filing patient statements, submitting super bills and encounter forms, organizing office finance, and generating prior authorization forms. Okay, and here's some professional organizations. It's going to tell you the benefits. I'm going to just let y'all see the benefits. I do want to point out a couple of them. They offer certification exams like our NCCT, and we talk about the AHIMA too, right? They're going to offer that. You have some opportunities to network with other coders within that. You can get newsletters and professional journals, discounts on publications, but this is the one that I really want to point out to you. Once you pass your NCCT and you get your certification exam, you're going to have to do furthering education every year for a certain amount of hours. I think it's 20 for some reason. Don't hold me to that though. But you're going to have to listen to sponsor conferences, do workshops, and web-based activities. NCCT sends out a list every month, and you just get to choose. It doesn't have to be, you have to go somewhere to a workshop. It's mostly web-based nowadays. Professional organizations continued. The AHIMA, American Health Information Management Association. Then we have the AAPC, which is the American Academy of Professional Coders. The AAMA, the American Association of Medical Assistants. And AMT, American Medical Technologists. That's the end. So I'm going to stop sharing. And I'm going to